All right, so this is the video for the shoulder exam. First, we're going to show you how to pin the gown back properly so you could expose the shoulders and the back when you're doing the inspection. So you're going to need one of these big button clips.
Okay, so you'll open the patient's gown and then you'll ask the patient to slip their arms out of the gown. So you're standing behind them, keeping the gown close to the patient's chest for them to help preserve modesty. And then you'll have it so that the shoulder's exposed. You'll grab the gown from the back. You'll roll the gown, and then you'll tuck the gown and clip the gown. So then you can ask your patient before you start going, you're like, does this feel comfortable for you? Can you move your shoulders around a little bit? And you can see here that the gown is staying up. If you have a female, you can ask them if you can clip to their bra or sports bra. Sometimes females don't want this, and you might have a male patient, so it's good to get into the habit of just learning how to do the twist, fold, and clip. Okay, so now that Carol's shoulder is exposed, we're going to start the exam. So first we'll go through inspection and palpation. So you can have the patient standing for this one. So you're just going to do a quick look. You can do all of one shoulder and then all of the other shoulder for this, since it's a bilateral exam. So do a quick inspection for any discoloration, bruising, muscle atrophy, masses or swelling. Then you can go through and you're going to palpate through. So Dr. Clark likes to say you should have annetters open when you're learning and practicing how to do this, so that you're actually palpating with purpose, because they can tell the difference of someone just coming through and poking and someone being like, okay, I'm going to trace through the joint capsule here. I'm going to actually trace the scapula. I'm going to come through the front, trace out the clavicle, and I'm going to palpate the different muscle heads. So you just want to do a quick palpation through. You're looking for any jump signs, trigger points, tender points from your patient, if there's a flip sign where the muscle will actually flip on itself. And then what's unique to the shoulder exam is going to be scapular winging. So you can either have your patient go over to the wall and then push against the wall, like a serratus anterior test. Or if they're right here, you can say, can you just push into my hand? And you can see if the scapula wings out. And then you can say, like, can you push into my hand here? And you can see if the scapula wings out. So depending on how much time and how close to a wall you are. Take a note of anything that you see here. Don't spend too much time on this, but again, like, go to the other shoulder and just make sure you're palpating with purpose. Yep.